Have you ever been told that your dad's side family history of breast cancer didn't matter? Or you were told by one provider to do breast MRIs in addition to mammograms, but your doctor told you to call your insurance and see if they'll cover those breast MRIs? Or maybe there was a genetic mutation in the family that's been known for years, but your parent was never tested, they didn't think they could carry it, or they didn't tell you about it. I've seen all these scenarios in my genetic counseling practice day in, day out. So when you ask why I started the Proactive Patients, it might seem obvious. However, my drive to provide genetic counseling services to those at higher risk for cancer actually started much earlier. So today we'll go into the story, why I am so passionate about getting people the information they need, the tools they need to be proactive in their cancer prevention. So my own grandmother was diagnosed with 5 different cancers over her lifetime. She did not actually die from any of them. When she was diagnosed with breast cancer when I was in high school, it opened up a curiosity in me to try to figure out what is going on. I did have a science report due for my biology class, so I decided to write it on cancer genes. Now, just to date myself for a moment, this is actually just before the first breast cancer gene was even sequence. They knew about where the gene was, but they did not have the sequence of this gene yet. But as a part of my research for my high school project, I interviewed the education director at the University of Michigan's Human Genome Project. And by the end of that interview, she offered me a job, summer internship, working with her at the Genome Project, helping her set up some workshops for high school students, high school teachers, and community college instructors, and get information out there about how to include genetics in education. She was involved in one of the Genome Project labs that was researching adult onset conditions, so including cancer genes. And that summer, they were so close to identifying that first breast cancer gene. The media was there all the time. It was a very exciting time, and especially since it related directly back to my grandmother's recent experience. Let's just say that got me hooked on cancer genetics. From that point, I decided to go to college with the focus on molecular biology and genetics, thinking that I was going to go into research. And I was able to have 2 more great experiences in the college setting. I studied abroad in my grandmother's home country of the Netherlands, did that while overloading in a chemistry lab in the Netherlands. That chemistry lab was researching treatments for different cancers, and I was able to get a little hands-on experience on the biochemical side of that research. Now, I never really thought I was going into chemistry as much as genetics, but it was definitely a great lab experience. Coming back home for my senior thesis in college, I went back to another genetics lab and did more research on one particular gene the whole summer. By the end of the summer, I realized I didn't really like lab work. So I was able to sit down with a genetic counselor who was the director of the program at that time. She sat down with me for 2 hours, kind of introducing me to genetic counseling and talking to me about what the field was, because my mentor in the lab thought that I would probably be better suited as a genetic counselor. Now, I had actually met this woman while I was helping the education director run workshops. She gave some lectures during those workshops, but that 2-hour experience really nailed it down to where I was going with my life, into cancer genetic counseling. I went off to graduate school. I got a master's of science in human genetics in a program that was specifically for genetic counselors. Got a lot of clinical rotation experience. Got my first job in prenatal genetics. It was still a great experience, but not exactly the reason I went into genetics. So it did still take some time to get a job in cancer genetics, which actually moved me back to my home state. So I was able to work in a community hospital seeing patients for family histories, personal histories of breast cancer, ovarian cancer, colon cancer, different types of cancers. That is exactly what I wanted to do. I was able to identify who's at higher risk, what they should be doing because of their higher risk for these different cancers. If they did testing, I was able to see them before testing and after testing, put those recommendations together, send them out to their providers, and then never see them again. I would occasionally get someone back to get updates on whatever gene they found out they carried, which was great, but rarely saw them more than those 1 or 2 times at the time we identified the high risk. But I was kind of disheartened because those who did come back often were not able to get the services that I recommended to them. They ran into barriers with insurance, barriers with primary care knowledge or GYN care knowledge, and weren't always getting the things they needed. Between that and the fact that I had to see one patient at a time and repeat myself a lot, I got to thinking there's got to be a better way to get this information out to people to help them connect and know how to connect, because there aren't that many genetic counselors out there. Help them get those services that they need from your perspective. So that's actually what this channel is about. It is going to be to get you information to help you figure out if you do have a higher risk, what makes a higher risk, what should you be doing, should you be pursuing information on genetic testing, what can you do with that information, what are the current guidelines, to keep you up to date with that so that you can have the knowledge, so you can make the right decisions for yourself and take that to your provider and say, I think I need to go do these things, and work with your providers instead of just being in the backseat of your own care. So if this information is what you're interested in, my suggestion would be to subscribe to this channel. But I also have a webpage, and I'll be starting a newsletter quite soon so that you can keep getting updated on this information, whichever form you prefer. So I would like to share this quote with you because I think it does embody what we have control over ourselves and what we don't have control over. You can do everything right and get cancer. However, you could do everything right and catch that cancer earlier, where it's at a treatable stage, where the treatment isn't as complicated or as hard on the body. Epictetus is a Stoic philosopher from way back in the ancient days, but had a great quote, not to worry about anything out of your control. The only things you can command are your thoughts and your actions. We choose our responses. Stop aspiring to be anyone but your own best self, for that does fall into your control. With that, what I'm trying to give you is control. Information is power. You can use it how you choose and decide to go with it or not. I bring that up because I started the webpage for the proactive patients at the beginning of January 2024 and started putting this information out. But a few weeks into it, it hit home again. My sister, who is 42 years old, had a seizure and was diagnosed with metastatic stage 4 breast cancer. It's never hit that young in our family before. But because of our family history, we knew that we were at increased risk, even if there wasn't a gene known involved. I'll get into a little more of how you figure that out for yourselves in future videos. But for her, she was doing breast MRIs in addition to mammograms. Her last mammogram was 11 months prior. And last summer, she got too busy to do breast MRI. Now, it may not have picked up her cancer. Her cancer is a fast-growing type. And it wasn't seen on some other imaging that she's done since. But the thing is, she doesn't know, and she's now kicking herself. We have no control over what happens. But if we do everything we know we have control over, it takes away that question if it does happen. Now, I'm going to read something I wrote. One, when I read this quote from Epictetus, but also just with everything that's going on with my sister. So I am going to look off to the side and just read this directly. When it comes down to it, you can't change your past. You cannot have known how your past self would affect your present self. You cannot control others. You control yourself in the here and now. There's no crystal ball into the future. You control your thoughts, your actions, and your reactions. You can sit and watch what comes at you, or you can take action and decide to be proactive. What will you choose? Learn, decide, and act. Learn so you know all your choices. Decide what's right for you in your situation, and act on that decision. Do not put off till tomorrow what you can do today. Decide what is important and act on it. That is my drive, to help you take charge of your own health and become a proactive patient.